are back. The roles are being reversed. Here I am with Sam Murton. Sam, you're on the other side this time.
Yeah, thanks.
The reason you're here is because you're becoming a distinguished fellow.
Yeah.
So, why? What? You've been handpicked from the bunch.
Yeah. I could say I don't know if any reason. No, I have no idea why. But I think for me, having worked in general practice education for a long time, and I've done that for about 10 years, and been involved in lots of big things, and been lucky to be involved in lots of things that are changing what general practice was doing. With the general practice program, it became a nationalised program over the time that I was there. It started before I got there, but we carried that through, and also working on the general practice curriculum, changing that so that it was more up to speed internationally and contemporary with what was going on in general practice in New Zealand. And then also, I think just the role being medical director at the college and involved in that, it was a great role to have, and be able to have some influence nationally with all of my colleagues, and also with the powers that be, the ministry and all those places. So
you also have an interest in surgery.
Yeah.
So how has that shaped your general practice as well?
I think when I first started in general practice, I'd been doing surgery for a long time, and I decided that 12-hour days weren't ideal for having a family, and by the time I had number 3 child, it was all getting a bit much. But not that I don't do 12-hour days now. However, I was involved with a group who was setting up a practice, and so I got involved and actually came on board as one of the clinicians. And I remember thinking, having done surgery for so long, that if a patient came in with asthma, then I was going to kill them, because I could only operate on them, I couldn't actually fix their asthma. Fortunately, most of my asthmatics did survive me. And I went into the training and got trained, and which was fantastic because it really got me up to speed fast. But the surgical thing's always been there, and I think from a patient's point of view, it's probably the biggest fear sometimes, that you get sent off to a hospital and you're going to have an operation. And because I've worked in a whole range of different surgical positions, it means that I can talk to my patients and say, look, this will be fine. What they're going to do is this. You'll come out, you'll be okay. And I know exactly what's going to go on and can explain that to patients. So I think from that point of view, that's been really invaluable for my patients as much as for me, being confident to talk to them about what's going to be happening and what they do next. Yeah.
So what does the college offer you now that you're not medical director, because you're on the other side, 12 months out?
Yeah.
What's the college offer you, as a service now?
Yeah.
What are the things it's doing for you?
Well, I'm still involved in training, so I have a registrars in my practice, and I love being able to help get new GPs through to fellowship and increase our numbers of GPs that we have in the community, because it's what our community needs. But also from a college point of view, they keep me up to speed with my recertification and make sure that that's okay. And I do like the new website, even though it's just starting. It's been actually quite good to sort of see it. Clear buttons are really easy for GPs. Mm-hmm. I can see that button. Yeah. And I think the other thing is I've been involved a bit with the self-care. So from my perspective, my college is my community of GPs and my fellows that I work with, and I think for me the feeling with this distinguished fellowship is that my peers appreciate what I've done and appreciate me and their service, which is really great. And I think for the future it would be great. It's good to see the college sort of moving into areas where they're looking after their members and doing some more stuff, and the self-care document, and making sure that the websites and things are up to speed and keeping us connected is a really good way of doing it. Yeah.
How are you going to keep yourself challenged from now on?
So at the moment I'm working in general practice half-time, and then I'm doing half-time at the University of Otago Wellington campus, working with the general practice department and primary care department there, and I'm a senior lecturer looking after 4th, 5th and 6th year trainees who are coming through the GP run. My surgical bent never goes, so I've been introducing a surgical skills component to the 5th year students, and I also am doing some communication skills with the 4th year students, and towards the end of this year I'm going to take up the role as the convener for the trainee interns who do the 6th year run in general practice, and so they aren't in the department at all, they're out in the community, so it's a matter of keeping connected with them and making sure that they're getting the learning that they need. Yeah.
So that's pretty full on.
Yeah. So it's busy, so I don't have any downtime.
Yes.
Yeah.
So Sam, congratulations,
Thank
and
you very
enjoy
much.
the moment
Yeah.
and enjoy the recognition from your peers.
Yeah, thank you. Yeah.